Good morning, everybody. Dr. Chris from Pere Smiles here for the next What's Up Wednesday video, where I get to tell you what's up. I'm just sitting here in my backyard enjoying a peaceful morning before the kids wake up, and my wife is downstairs working out. And I thought, what better time to get outside and share some information about lip and tongue ties. I really want to talk about a couple different myths of tongue tie that you will read on the internet, or potentially your medical provider will tell you if you ask them about your child's lip or tongue tie. So real quick, I'm going to tell you, we are going to post a link to an awesome article called 8 Myths of Tongue Tie by Dr. Richard Baxter. He has the Tongue Tie Center of Alabama, and he wrote the book called Tongue Tied. He speaks all over the country, and I've talked to him. He's a fantastic practitioner. So check out the article. It's pretty interesting. But the first one that parents say all the time is when they come in for exam, for their little one, if they're having breastfeeding or bottle feeding issues, is, we thought we'd just give it time because that's what we were told to do, instead of seeking help right away. Here's what I tell parents. We want to get things evaluated as soon as possible after baby's born, because if babies can't suck properly, they will form muscle memory incorrectly. They will compensate, we call it, in a lot of different ways if they can't use their tongue and their upper lip properly during feeding. And like I said, muscle memory builds up, and then they have a tougher time adjusting to a tongue tie or a lip tie release. So the magic, or the sweet spot we like to do, is before the baby turns 10 to 14 weeks old. Then we can be off and running with the baby right after the procedure, and a lot of times they feed fantastic right away or within the first week after the procedure. Okay, so that's number one. Don't wait. Number two, I hear it all the time. Parents say, we thought maybe there was a lip tie issue, and we asked our pediatrician, and they said, don't worry about it, just wait. The child will, start walking someday, and then they'll fall and break it on their own. That's kind of a crazy thing to say to a parent, if you ask me, because if a child falls, if they break their lip tie, there's going to be blood everywhere. It's going to be a traumatizing thing for everybody involved. It's going to be tough to get the bleeding to stop, and you just don't want your kid to go through that. So getting it fixed properly with a laser when you have zero bleeding, and if you do it young enough, the child will not remember a thing, and then you won't have to worry about a lip tie ever again. But you want to do it properly. Okay, that's the other thing. If you trip and fall when you're 2 years old, it's going to bust incorrectly. Okay, and it's not going to be a full release. It's not going to accomplish the goal. The other thing it's going to do is it's going to heal back together. So when we do a lip tie release on any age patient, we have parents do stretches after the procedure to make sure it heals back together appropriately. Okay, so, and it's going to be thicker tissue if it heals back together inappropriately, scar tissue and that sort of thing. So it potentially could cause some issues that way. But that's it. You want to fix things sooner rather than later. I guess that's the point of the video today. So get things checked out. If you got any questions, you can ask those pointed questions to your medical professional, and hopefully get to someone that can evaluate the lip or tongue tie properly. All right? So check out that article, guys, and we'll see you next week. Thanks.